Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi Spa. Welcome to Bellissimo Live. Today I want to talk about facial rejuvenation procedures, mostly facelifts and neck lifts. I'm joined by our mannequin Angela to help demonstrate what we're talking about. So the most common thing that patients come in is they want to reverse the aging process. And obviously aging is inevitable for all of us. And now with so many people using the weight loss medications or semaglutides, we can also see aging with dramatic weight loss, and mostly in the face. So when we age, it's not just a skin problem, and that's what we all think. If I just pull back on the skin, I look a lot better. However, it's really the layer of tissue under the skin. So there is a layer of tissue that lives on top of the muscle and below the skin. It's sandwiched in between. So if you watch infomercials about, that the facial muscles might be becoming more lax as we get older, that isn't true. It's that fibrofatty layer. And what that means is, as we're young, we have fullness in the cheek, we have fullness along the jawline. But as we age, things seems to shift downward and forward. What we see in the mirror is deepening of the folds along the mouth, lines down here, and some jowling in this area. We also start to see some neck laxity, where everything is just sort of getting a little bit softer in the neck. Those are the symptoms and the complaints what people want to correct. So in a facelift and neck lift situation, it's again not just pulling back on the skin. What we need to do is using some strategically placed incisions right around the ear here, called the tragus, and around the earlobe, back behind the earlobe in that crease, and up to almost right at the top of the ear sideways here. We want to come up about this high and then out onto the hairline here. That allows us to dissect up the skin all the way out onto the cheek and down into the neck, exposing, now that skin is kind of flipped forward, we're exposing that layer of tissue, and that's where the tissue that we need to reset. Now there's different ways of doing that, and there's different techniques. A lot of us use an incision through that layer down into the neck. You get under that layer, and that layer is called a SMAS, S-M-A-S layer. We want to get underneath that layer and pull it back and put it back into position. So you can trim the excess, but you sew it actually into position. And what that does is it restores that fullness in the cheek. It gets rid of the jowling and softens that line right at the corner of your chin. So once we pull that layer back, now you can redrape, and you do have some extra skin as we age, but now with that SMAS layer in place, that's the foundation for the lift. Now you can redrape the skin and then trim the excess skin off and suture it into position. What that will do is tighten the neck, tighten the jawline, and tighten the cheek. So when patients talk about, I don't want to have a facelift, because they think the facelift is from the top of the head to the neck, the facelift itself is really from the cheek down into the neck. A neck lift is really just the lower jaw and neck area. So depending upon how the patient presents and what their aging symptoms are, they may be a good candidate for a neck lift. But in many cases, as you start to get older, you start getting into your late 40s, early 50s, sometimes when you simulate with the patient how much you need to lift this, when you start to see that skin bunch up here, sometimes converting that to a facelift is a better approach. And that facelift incision is really from the top of the ear and around. So the same incision as the neck lift, but it just goes a little bit higher because you want to get to this area here at the top of the cheek. So as we can see, pulling all this back, it will replace that fatty tissue, that fibrofatty layer, back onto the cheek, redistribute the tissue that's bunched up on the lower part of the lower jaw, redistribute it over the course of the lower jaw, and pull that skin off the neck. So that really gives that nice tight appearance to the neck, makes the angle from the jaw to the neck much more acute and well defined. It also redefines the cheek, and it softens these lines here. Now, Facelift and neck lift surgeries will help soften these lines, but it will not eradicate those lines. So if you are somebody who is already using some dermal fillers to help soften those lines, you may still need to use those once in a while. Sometimes we can use fat grafting, but surgery itself does not eradicate lines and wrinkles. It will help soften those, but that's the foundation. There are, as a group of people that come in to see me that are just starting to see the early signs of aging, and they're starting to see that neck laxity. They're starting to see a little bit of lines here at the nasolabial fold, but they really don't have a lot of shift yet in that SMAS layer. So for those patients, you can actually use dermal fillers back in this area and along the jawline to give that little bit of a lift, a little bit of a foundation. So as you start to see signs of aging, it does not mean that you have to have a facelift or a neck lift, but you might be in time wanting to do one of those procedures. But realistically, there are a lot of other things that we can do. Number one, as I just spoke about, dermal fillers. We also have microneedling and radiofrequency device called Virtue that can also help tighten that skin a little bit. We have a CO2 laser called Helix that can also help improve the texture of the skin, the glow of the skin, the tone of the skin, and help tighten that skin a little bit. So again, depending upon where you are at along the aging cascade and really what your goals are, because at the end of the day, you may not want or be ready to do the incisions, but you just want a little bit of tightening, so the non-surgical modalities may be enough for you at that stage. However, if you have a lot of laxity in the skin, the SMAS layer is way down, those modalities may not be the best for you and may not be something that is efficient for you. In that way, in that sense, the surgical procedures are your best choice. So say you undergo a facelift or a neck lift. What are we looking at as far as surgical time? Facelifts and neck lifts. Neck lifts are a little bit shorter, but facelifts can take somewhere between 2.5 and 4 hours of surgery. They can be done under local anesthesia. I prefer to do them under IV sedation in the surgery center. Once I'm done, then I usually have patients wear a wrap for the next several days for some taking the tension off and just keeping the swelling down to a minimum. Patients come back to see me the following day. I can change the wrap at that time and put them in another wrap. They'll wear that for the next 3 to 4 days. I take out the stitches along the incision at about 6 to 7 days. As far as downtime, you really need to take some time to recover after any of these procedures. That means nothing around the house, no housework, no bending over, no pushing vacuums. You're going to be, depending upon what you do for work, if you're at a desk job, computer, where there's not a lot of physicality to it, you may be able to go back to work in about a week and a half to 2 weeks. I usually prefer 2 weeks. If it's something that you are more physical, you're lifting, you're stocking shelves, you're driving, you're on your feet all day, then you might need 3 to 4 weeks off of work. So it really depends on what your job is as to when you can get back to work. I don't let anybody exercise for the first 3 weeks. I don't want your heart rate up because you increase the risk of some bleeding, swelling, some bruising, some absolute things that you cannot do. Smoking, any type of nicotine, whether you're smoking it, vaping it, patches, gum. Nicotine is a very powerful vasoconstrictant, which means that the blood supply to where these incisions are, those blood vessels might be closed off. So now you're not getting a good blood supply. The scarring can be much more prominent. It can widen. You can have trouble healing those incisions. So absolutely not. Marijuana, even medicinal marijuana, can be an issue. So I want my patients to be off of marijuana and nicotine for a minimum of 4 weeks prior and 4 weeks post surgery. Anything that you're going to do to cause more swelling puts more pressure on the incisions, which can lead to a less optimal outcome. When can you get back out to being with friends and family and go do things? I've had patients that go out for dinner in a week or two. So most of the time it's between 7 and 10 days. Women that wear their hair long can hide those incisions. They're going to be pink for a while, and it will take several months before that pink incision starts to fade to white. Being outside, if you do this over the summer months or spring months, then you need to make sure that you have a hat on, and you also use sunscreen, because you want to keep the sun rays off of those incisions. When you have an incision that's been stimulated by ultraviolet light, they can actually heal darker, and you really want those scars to fade. It can be done on all different skin types, whether you have really dark skin or very fair skin. These procedures are not a problem for skin types. So again, if you're thinking about these procedures, they're very well tolerated from a standpoint of pain. Most patients don't have a lot of discomfort at all. Many of my patients will just take Tylenol or maybe a couple of narcotic medication for the first few days. There's no dietary restrictions. I want you to stay hydrated. I want you to take in protein. But realistically, there's really nothing that you have to stay away from. I really don't want you to be doing a lot of alcohol for the first week or two, especially because you have the effects of the anesthesia. And if you are taking some narcotics, you really want to be off of the narcotics before you take any alcoholic beverages. Another question patients want to know is, when can I drive? Most patients will drive between 7 and 10 days when they feel more comfortable about getting out of the house. So that's the usual time frame.
How long do the results last?
Great question. So facelifts and neck lifts usually last on average 6 to 10 years, with the center of around 8 years being the most common. All right, I hope this was helpful to kind of delineate why, when you want to do a skin tightening procedure in the face, it really doesn't have a whole lot to do with just the skin. You have to tighten that layer underneath. I hope it kind of gives you some idea of what the downtime would be, everything else. So if you have any other questions, feel free to reach out to us and ask us questions. Again, thank you for joining me for Bellissimo Live, and I'll see you next month.